Hi friends, welcome. I have been attending the Gurukul session that has been actually organized by Dr. C M Wavikar, and I've been as fascinated by the objective of this session and how it has impacted the young ophthalmologists who attended the Gurukul. We have with us Dr. C M Wavikar, a very renowned surgeon. He leads no medicine. He is one of the top 10 surgeons of India. And I also have with us Deepak Marul, and he also is quite a name with all his YouTube videos and channels. Um, I just wanted to come to first with Dr. Wavikar. In this, the enthusiasm with the young ophthalmologists attending Gurukul. I was just thinking that this must have, you must have realized some gaps. When did you start, this idea? What did you observe the gaps as? And, how did you start the process?
Yeah. Thank you, Subha, and welcome, Dr. Deepak, to our show. See, basically, we have big conferences, and there are a lot of people who want to have us very small difficulties. But sometimes it's very stupid to ask the difficulties doubts, and sometimes there is no time, and so on and so forth. And there are many times, it is difficult to approach any other person, surgeon especially. And therefore, these questions remain in their minds. And therefore, we need to have a small group where these people will be able to ask such questions. And that was the basic thing in my mind. And I wanted to keep the course to a really simplistic level so that when people go home, their practice should improve. Okay, they should be able to implement only 5 to 10 points, but it will make a vast difference. Ultimately, people changing their practice style, improvisation is going to help our patients.
Right. That's a very noble thought and idea, Dr. Wavikar. If I may ask, actually, this has been the ninth year of, the Gurukul. You have been doing it almost for a decade. Yes, are you staying among the young ophthalmologists between then and now?
Whatever changes or waves we are seeing, luckily, not much of that is there. People are really very sincere, and people will open up, they ask questions, and there is a really good level of interaction.
Excellent. And coming to Dr. Deepak, I mean, your presentations, a lot of tips for the young ophthalmologists. What has been your experience for the best session today?
I think I must congratulate Dr. Wavikar for choosing the topics. They're so real and which have a direct impact on day-to-day practice. They're very small things like IOL calculation process, how to assess the patients preoperatively. And even during the live surgeries, we were very slow to ensure that each step is explained in a very proper way so that the aspiring young surgeons have many take-home points to go. And definitely, it improves their day-to-day practice and has a great impact on how ultimately the patient care is going to be. That's ultimately the main, the core message of the group meeting. So the ultimate beneficiary is going to the patient through better service. So we try to share our knowledge, which we are gaining through so much of experience, and we want to share it with our colleagues so that the younger surgeons don't have to go through all the rigors and trial and errors which we have gone through, so that they can have a sort of a ready-to-eat food ready. That is the goal.
That's a great point that Dr. Deepak has made actually. During their time, there was no probably social media, LinkedIn, no platform basically to share information and knowledges to learn from. And to that respect, I mean, the young ophthalmologists today are, are a bit lucky. So what, kind of, advice you would like them to have, in kind of, going forward? If there were a few advices, 1 or 2 points that you want to make, that they should always keep top in their mind, what would be like beyond these, the clinical and scientific aspect?
Yeah, just elaborating the point which you said, the younger generation are blessed because the information they have is at fingertips. Right? In our era, if you want to learn one surgical tip or one practice management tip, you have to wait for 1 year to attend a conference and then gather that one thing. Now, the information is just at the fingertips. The problem is there is a lack of focus because the drive is necessary. So nowadays, the differentiation is not on the availability of the information. The differentiation is what you do with that information. So ultimately, if you want to go ahead in the race, how we are going to use that information for your benefit and your growth? The information is now it's democratized. Information is available free to everyone, the same level. The winner is the one who makes it count with that information. So bottom line is how much hungry you are, how much drive you have. That's it. But this country, current generation is blessed compared to what it was.
That's a great point of the Deepak you have made actually, that the information is there, but the application may be, where the guidance is. What are your thoughts, Dr. Wavikar?
Yeah, I think the first point is that we did not have live surgery. It is deferred life because now live surgery is banned. We invite various speakers, right? And in that also, we try to make them talk on their passion. Like his passion is making great videos and editing them. So we made him talk on that. And when people talk with passion, it is kind of inspiration. People get motivated to do it.
Right.
Second thing is, going into details. So the next generation should have passion about doing something, going into details. And nowadays there is a, craze for quick results, but Rome was not built in a day. It takes time. So people need to understand it.
One thing that I have seen in attending today at this year's Gurukul is that, you have a flipboard there where, the speakers came down, Dr. Wavikar himself came down many a times drawing and kind of explaining the things to the participants, to our young ophthalmologists. That was fascinating. That was really
There's one more addition. And tomorrow we'll have voting. So we'll ask questions and people will vote and we'll discuss various, surgical steps. Why you think like this? Why you think like that? What are the plus and minus points? So that way, what happens when the surgeon is faced with that difficulty, he is better equipped to handle it.
Absolutely. That's great. Amazing. So, Dr. Wavikar, having conceptualized the Gurukul 10 years back, and you have been consistently, organizing Gurukul for the benefit of the young ophthalmologists, where do you see Gurukul going in the next 5 years?
Yeah, that's a very good question. So, one very simple rule is that let this year be better than last year. So we keep on adding things, we keep on simplifying things, we keep on curating topics, and that is making things better. The things which are readily available on internet, YouTube, and all this, we try not to, not to show them because they are already available. But talk of those things which are not easily available. And that is making difference. We want to increase participation more. So we're going to work on it. Like I told you, voting is there, and there are more things they are adding. And that will definitely, basically, they should become thinkers, not passive followers. So working towards that.
2 points I take from Dr. Deepak and Dr. Wavikar. Dr. Deepak says about application is important, the information is here, but how do you apply it in your practice? And Dr. Wavikar says something about, more workshop oriented, and it is already workshop oriented. Probably this next year Gurukul is going to be more participant workshop oriented. For an information, there is also weight lab over here. Well, I will leave the speakers there. Dr. Wavikar and Dr. Deepak, it has been a really a great day for you, and it has been also maybe tired also a little bit for you. Thank you very much for your participation.
Thank you so much.
Thank you very much.